7 warning signs your heart might be in trouble, and the 7 symptoms of heart problems you shouldn't ignore. Hello, how is your heart doing today? Are you having any little issues? I'm going to discuss the 7 physical symptoms that can suggest that your heart isn't functioning properly. We are aware that cardiovascular disease is the leading cause of death in both the US and the rest of the world. The first part of this video discusses the 7 signs that you can see that there's something wrong and what you should pay attention to when looking for heart problems. According to the Society of American Cardiology, the heart kills about 700,000 Americans nationwide each year. The second section will cover the 7 signs that your heart isn't functioning properly. Did you or a member of your family experience it? Keep watching until the very end because I'm going to give you valuable guidance on how to prevent heart problems in the future. I'm confident there will be a lot of information you have never heard of. But before we start, don't forget to turn on the notifications bell and subscribe to our channel for more daily advice like this. 7 signs and symptoms that your heart may not be well. 1. Frank's sign. Can you tell us the 7 indicators you should be aware of that could indicate you have a heart condition? These are the 7 Frank signs you should be paying attention to. You'll begin paying closer attention to people's ears starting today. I'm certain of this because there is a small indicator in the ear that can show whether or not someone has a blockage in their carotid, coronary, or cardiac arteries. In the 1970s, Dr. Sanders Frank observed that many of his angina patients had a diagonal wrinkle in their ear, which he named Frank signs. What link exists between the ear and the heart? According to one idea, the same elements that induce artery edema damage can also cause this crease in the ear. Are there any Frank signs without a blockage? No one in 100 who has this diagonal line in their 30s has anything other than an age mark. However, if someone is under 70, they are more likely to have carotid or coronary occlusion as a result. Given that the sensitivity of this signal is low and that only 1 in 10 persons has obstacles, we must thus pay closer attention to someone who is 40 years old and exhibiting the Frank sign compared to someone who is 80 years old. You can celebrate if your ear is flat because only 40 will exhibit the symptom of heart trouble. 6. Hair loss on legs. If you have peripheral artery disease, which is a blockage in the arteries of the legs, and if you have atherosclerosis, which is not a localized illness but a widespread one, you may experience hair loss that starts on your shins and then spreads to your thighs. A blockage in the coronary arteries, which feed blood to the heart, as well as other arteries in the body, may be the cause of your leg artery obstruction. When atherosclerosis has progressed, most people with peripheral artery disease only become aware that something is wrong. What causes them to lose hair? Since their fur requires nutrients to grow, hair follicles require healthy circulation. Blood won't get enough oxygen if your arteries are blocked by an accumulation of fatty plaques. The person may also experience cool skin, smoother and brighter skin, and slower nail growth in addition to losing hair on their legs. But allow me to point out that, in addition to peripheral artery disease, genetics can also cause hair loss on your legs from rubbing against your genes. 5. Xanthelasma. This is known as xanthelasma, and you must have seen it when you glanced into someone else's eyes and saw a yellow plaque on the eyelid. It doesn't hurt, and most of the time it's only a cosmetic issue, but it steadily becomes worse. The most typical form of xanthomas, which are cholesterol deposits in the skin, are xanthelasmas. It is more prevalent in middle-aged women and typically found on the upper eyelid and the inner corner of the eye. Most individuals who develop xanthelasma have dyslipidemia, high cholesterol, or high triglycerides in about 50% of cases. It's also interesting to note that while just 1% of patients with high cholesterol have xanthelasma, studies have shown that this condition raises the risk of heart disease, heart attack, and stroke. So if you have xanthelasma, you must get a blood test and check your triglycerides and cholesterol levels to make sure they are within normal range. Number 4. ARCA senilis. It has to do with age, as the name would suggest, and older individuals are more likely to have it. It appears white or gray and is seen above and below the outer region of the cornea. It is brought on by cholesterol deposits at the border of the cornea. Some people's iris, the colorful portion of the eye, may be taken over by this halo. You can tell that person since their eye was formerly dark and is now becoming lighter. The ARCA senilis does not impair vision and does not require treatment, but there is a warning if the senile halo appears in younger people before age 45. In this case, it may indicate that the person has severe dyslipidemia such as very high cholesterol or triglycerides and is linked to a higher risk of getting cardiac disease. It is typical to have a senile arch if you're aged. You shouldn't worry if you're over 60 because you may find the senile arch by looking in the mirror. About 60% of those over 60 have it, and after the age of 80, it affects almost 100% of people. Number 3. Cyanosis. The bluish tint or bruises on the skin, known as cyanosis, may indicate that it is too chilly outside and that you are suffering from a heart or lung condition. When you are hot, if a portion of your skin turns blue, cyanotic or purplish, this could indicate that an artery is congested or that this section of your body is not receiving enough oxygenated red blood. Now, if someone experiences trouble breathing, it could be due to a lung condition, pneumonia, emphysema, a pulmonary embolism, or heart failure when the heart is unable to pump enough oxygenated blood. Of course, other conditions also apply in this situation. Cyanosis is brought on by heart diseases including tetralogy of Fallot, a congenital abnormality. 2. Ulcers. Your feet or legs may have sores that don't heal because of inadequate circulation. If there is an obstruction in the artery that supplies the area's irrigation, it may be the cause of artery insufficiency. Typically, people cannot walk long or quickly because their legs become more fatigued, sore, or even cramping up. These ulcers are typically painful, but if you have a nerve condition like diabetic neuropathy, you could not experience any discomfort. In most cases, arterial ulcers do not bleed and typically develop on the outside of the leg, on the heels, and on the toes. The most prevalent and other ulcers are venous, which are caused by varicose veins or venous thrombosis. Number 1. Leg swelling. In contrast to arterial, they frequently bleed and harm the inner leg. Leg, ankle, and foot edema are 1Th symptom. This edema or swelling in the legs and ankles may be brought on by an underactive heart or an infection that can result in fluid retention in the body. If your shoes are too tight, the ankle will seem fluffy like it's making bread and will make the divot known as the Lucker sign when you press on it. Gravity causes leg vein pressure to increase during the day, making it more likely that you'll experience swelling in your legs and ankles later in the day. Swelling is also decreased by lying down and elevating your legs. Now, what are the 7 indications that you might be experiencing a cardiac condition? Number 1. Shortness of breath or dyspnea. Dyspnea or shortness of breath is the first sign you should be on lookout for, especially while exerting yourself. It could be a cardiac condition if your level of breathlessness is out of proportion to your efforts. Number 2. Persistent cough. They have fluid in their lungs and their alveoli if they cough up white or pink phlegm. It's critical that you get medical attention as soon as you notice a cough. 3. Shortness of breath. In order to see if you sleep better, you start adding pillows to your bed when you first get there. Eventually, you can no longer lie down and must sleep in a chair. The condition known as paroxysmal nocturnal dyspnea causes you to suddenly feel as though you are being suffocated. This strongly suggests that you have a heart condition. 4. Generalized weakness. Constantly feeling exhausted and finding it difficult to carry out simple tasks like walking or shopping, as well as climbing stairs. This is due to the heart's inability to pump enough blood to supply the body's tissues and muscles with what they require. Number 5. Nocturia. Nocturia is a term for having to get up frequently during the night to go potty. There are numerous explanations, but this extra liquid needs to be expelled if the heart is not pumping adequately at night. 6. Intermittent claudication. A few meters of walking cause you to experience calf soreness. When you put forth the effort, it's not painful. The blood is not getting there as it should according to this symptom. When you pause, the pain subsides. When you move, the pain returns. Last but not the least, chest pain. The first thing you should consider if you're experiencing chest pain is a cardiac issue. Muscle gas or anything else simpler might not have crossed your mind though. It might, but you must always rule out the most serious possibility. A chest pain or discomfort that lasts for more than a few minutes is referred to as heart pain. It is a movable object. It could feel heavy or tight, or it might burn. Sweating, pallor, nausea, and dizziness may or may not be linked with it, and it can radiate to the left arm, neck, back, jaw, stomach, and both elbows. It is important to visit a doctor as soon as possible if you have these symptoms. Now, let's talk about how to avoid developing a heart condition. Do some exercise, get up from your chair, and keep going. Your heart, circulatory system, and mental health all benefit greatly from regular physical activity. Walking, cycling, and swimming are low-impact activities that can help to normalize blood flow that has been hampered by persistent vein and artery obstructions. Stop smoking if you do. One of the worst things you can do for your health is to smoke. Smoking increases the risk of heart attack, stroke, and dementia by causing impotence, inflaming all of your arteries, and forming fatty plaque. Lose excess weight if you are overweight or obese. Weight increases the risk of thrombosis by raising blood pressure, making blood sugar problems worse, and taxing the heart, kidneys, joints, and venous system. Eat healthily, including lots of fruits and vegetables, fiber-rich whole grains, olive oil, and less red meat and processed food, in addition to boosting the amount of fat in the liver. You need to pay closer attention than other people if you have a family history of heart conditions, especially if a parent or sibling has had a heart condition, heart attack, stroke, stent, or heart surgery. If multiple members of your family have heart conditions, you must conduct more thorough exams. I care about your triglycerides and cholesterol, so increase your intake of oats, eliminate trans fats and saturated fats to help you lose weight, increase your fiber intake, and even do everything right if you can't lower it. If your doctor gave you medication, don't be upset. Even though you do everything to keep your glucose under control, since the liver produces 80% of all cholesterol, it may occasionally not be enough. Controlling your glucose levels effectively lowers problems if you have diabetes or at risk of developing it. Finally, manage your blood pressure by keeping glycated HB below 7. Your objective is to keep your blood pressure between 120 and 80. For other people, a less strenuous target would be to keep it between 140 and 90. Naturally, you should see a doctor, explain the situation to him, and follow his instructions if you believe you may have a heart condition, have noticed several signs and symptoms, and experience some of those symptoms. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this.